The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as you before we, as
USV, your reliable healthcare partner.
Namaskar, welcome. I welcome you all to this very interesting, much needed, timely program on women and diabetes. And I am joined by 4 of my most accomplished, amazing, wonderful colleagues. To my left is Professor Sarita Bajaj. Sarita is current president of the Research Society for Diabetes in India and also editing a book on women and diabetes. Thank you, Sarita, for coming. Next to Sarita is Professor Mala Dharmalingam. Mala is the professor and head of endocrinology at Ramaya Medical College, a much sought after speaker and researcher in the field of diabetes. Thank you for coming. Yes. And to her left is Professor Motushi Roy Chowdhury. Professor Chowdhury was the professor of pediatric endocrinology at the Institute of Child Health. So she brings her strength on diabetes in children. Thank you for coming. And to her left is Dr. Neeta Deshpande. Neeta is an endocrinologist from Belgaum. And in addition, she is considered a national expert on bariatric and obesity medicine, which is very relevant to today's discussion. Thank you all for being here. First, diabetes itself is on the rise. There are about 400 plus million people in the world with diabetes, and half of them are women. In our own country, we have 70 million or 7 crore people with diabetes, and 1 out of 2 of them has diabetes. But is diabetes something different and more difficult in women? And is that why we are having this discussion? And the reason is diabetes increases the risk of heart disease in women. It increases the risk of stroke, depression, fractures, and even cuts their life short. That aside, women have their own other challenges due to their life cycle. There's an important condition called gestational diabetes, which is diabetes occurring during pregnancy. And this is a very big risk for the woman herself and the future generations. And I'll start with Professor Sarita Bajaj. So why do you think women are at risk for diabetes?
Even though we're talking about diabetes in women, there will be almost 200 women with diabetes worldwide, and 1/3 of them don't even know that they have diabetes. As far as the risk factors are concerned, there are some very well established risk factors like obesity. Women tend to be more obese, physical inactivity, a family history of diabetes, history of a high blood pressure or high cholesterol, history of coronary artery or heart disease, history of pre-diabetes. But there are 2 important risk factors which are very specific to women. Suppose a woman delivers a large baby, that would be say about 4 kilograms or 9 pounds, or if the woman has gestational diabetes, then she is at risk for type 2 diabetes later. Polycystic ovarian syndrome, which will be discussed later, is also a very important risk factor for diabetes. Even though increasing age predisposes women to diabetes, but now we are seeing frank type 2 diabetes in young children, adolescents as well as adults.
Thank you, Sarita. So we'll ask Dr. Neeta Deshpande this question because Sarita talked about obesity being a real big problem. So why is that so, and is it their hormones, is it their lifestyle?
Actually, Usha, both hormonal and lifestyle factors play a part. Biologically, women have far more fat in their bodies as compared to muscle if you looked at men and women. And because of this, women expend less calories, burn less calories for the same activity that they do, and this makes them more susceptible. Additionally, women go through phases of their life which promote weight gain, such as puberty, then they have pregnancy, and then they go through menopause, all make them increase their weight. And the lifestyle factors are equally important. Women enter the workforce, they are working all day, but they are sitting. Actually, sitting is the new smoking. So much of sitting makes them fat. So that is important. So my message would be, keep your waist circumference at 80 centimeters, because that's the killer if you go more than 80 centimeters. Because for every level of obesity, women have more diabetes than men.
Thank you so much. Dr. Mala, this gestational diabetes, it's rising so rapidly. I mean, how serious a problem is it for women?
Gestational diabetes is a very important problem. Any glucose intolerance found out first time in pregnancy is called gestational diabetes. The problems are different. If it occurs in the first 3 months, which we call the first trimester, the problems are birth defects. And if it occurs later, after the 4th month, then the problems are different, that the baby is born big. This translates to the fact that the baby may have a difficulty in birth. There will be maybe shoulder dystocia, or the shoulder gets stuck, and it may lead to operative deliveries. The reason why this gestational diabetes is increasing is the fact that girls are getting married a little older, they are becoming more heavier or overweight, and the most worrying aspect of it is not only does this problem happen during pregnancy, this woman who is pregnant and having diabetes can become frankly diabetic later. As you know, gestational diabetes will go away as soon as the pregnancy delivery happens, and not only she but the baby also is prone for diabetes at a later stage. And now if this becomes a girl child, then this vicious cycle goes on and on.
And Motushi, we always think traditionally of diabetes as a rich person's problem or a problem of affluence, or that's what it was thought. And we always thought it happened only to people living in major metros and cities, but we now know it's happening in rural areas. And why is that?
Yeah, that's a very interesting question, Dr. Usha. Actually, the main reason for increase in diabetes in the rural population is because the urban-rural divide is now becoming indistinct, and urbanization is spreading very fast into the rural areas. And then thanks to media campaigning, you are having processed food, fast food, baked products, colas making inroads into the villages as well. And add to this the level of unawareness. And another point I think is that migration, stress related to migration from rural to urban settings, that could also be a cause for increasing in diabetes.
And coming back to Sarita, we traditionally again think of women as being protected by their hormones against heart disease, and women are supposed to have an advantage over men in that area. But so why do women with diabetes have so much heart disease, and are their symptoms different?
Dr. Usha, that is a hard fact, that heart disease is a very big killer in women. Almost one woman is dying every minute because of heart disease. Even premenopausally, even if women do not have other significant risk factors, they are very much susceptible to heart disease. But postmenopausally, that goes up much more, because like you said, they lose the advantage of their female hormone, that is estrogens. If we just compare women with each other, then women with diabetes have a 5 times greater risk of developing heart disease as compared to women who do not have diabetes. The other interesting feature is, like, we are conditioned to think that a heart attack means severe chest pain, it's easy to diagnose in that condition, but what happens is that it's silent. So if at all they get symptoms, the symptoms are different. Number one, the pain occurs in the back, the lower part of the chest, upper part of the abdomen, or in the jaw. The symptoms are different, like lightheadedness, profound fatigue, nausea, vomiting, dizziness. And these risk factors are additive. As you increase risk factors, the chances of heart disease increase. But the biggest risk factor today is tobacco. A lot of women are smoking, younger and younger women are smoking, and tobacco causes premature menopause. It causes premature hardening of the blood vessels. and small vessels. Good glucose control improves both.
Motoshi, you want to tell us about why stroke is such a big problem in women and what can we do to decrease the risk?
We've just heard Dr. Sarita talking about heart attack in women. Stroke is an equally important vascular complication, and especially in women, we see that the rate of strokes is higher and also the fatality from strokes is higher. But the good thing is that we can prevent it. The risk factors, of course, Dr. Sarita has already discussed. They would be the same for both heart attack and stroke. But if you want to prevent it, I think there's a simple way out. We can just go for controlling the A, B, C of diabetes. A stands for the A1C levels, which should be in the controlled range. B stands for blood pressure, which is the most important parameter we need to control to avoid strokes. And C stands for the cholesterol levels, which again should be in the normal range. And maybe we can add a D and E to it, that is diet and exercise, which are as important as always. Smoking is a very important risk factor and should be avoided if we want to bring down the incidence of stroke.
Thank you, Motoshi. So we have heart attack and brain attack. So both seem to be very, very serious problems, which brings me back to you, Mala. So we've heard this. Should we be very, very aggressive with women in terms of targets? And what do the guidelines say?
So the aggression need not be different for women compared to men. But yes, we should have a good control. At this point, I would like to also stress that women should take their health seriously. They should go to the doctor to get it checked, and they should try to take the targets that I will be mentioning, which they should have. So when we are talking about all these risks of complications, there are three very important things. One is the blood glucose control. The 3-month average is very important. Very often people come and say, doctor, I've done my fasting or I've done my postprandial. That is not good enough. So they have to do their 3-month average, which is called the HbA1c, and typically it should be between 6.5 to 7%. And the next, which is the B, which is the blood pressure, should be ideally below 130/80. C is the cholesterol, which we say lipid profile, out of which there is a component which is called LDL cholesterol, which is the bad cholesterol, colloquially speaking, which should be less than 100. And there is one called non-HDL cholesterol, which should be less than 130. And more importantly, that they should go and check up. And here I think family support will play a large role, because generally the caretaker, the woman, takes care of the whole family but puts herself last in most of the situations. So I would request all the family members to support her, to make her feel that it is important that she should take care of her health.
Thank you. And I can just add, we as healthcare providers also need to take our women very seriously.
Absolutely.
So, which brings me to you, Neeta. Why do women struggle with weight after their pregnancy, and what should be their ideal weight gain and nutrition during pregnancy?
Before I answer that question, I should tell you that it's interesting to note that you ask any woman when she started putting on weight, and she will always tell you that I was real thin before marriage, and after pregnancy and childbirth I began to gain weight. Yes, yes. So the reason is that most women are not aware that they need to keep a check on their weight, even especially during pregnancy, because they need to put on just an X amount of weight. And what is that weight? The doctor will be able to tell them. Eating for 2, as the ancient wisdom goes, was all right then, but not now, because most women are already overweight when they go into pregnancy. So they really need to keep a check on how much they're going to put on during that pregnancy, because it's very difficult to knock it off later. A good balanced diet is more than enough for good breastfeeding. So they need not load themselves with calories which they are not able to knock off later, and that's the issue that they face.
Thank you. And if I may, just want to do a plug for breastfeeding, because not only is breastfeeding, we know, good in so many ways,
Yes.
it's also known to prevent type 2 diabetes. I think we have had a very, useful discussion on, risks and complications, and so we'll take a small break and come back and discuss do's and don'ts and treatment and prevention. So stay tuned, everyone. Thank you.
You The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care. The faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV. You before we, at USV.
USV, your reliable healthcare partner.
Welcome back, viewers. We now move on to the second session, which is, I think, even more important, which is talking about how to take care of oneself who has diabetes, and then how not to get diabetes. Sarita, can you give us some simple do's and don'ts, because the number one thing that people have on their mind is, what should I eat, what should I not eat, what should I do, not do?
As far as the do's, the very important do's right on the top of the list would be exercise. So regular exercise, the specifications are laid down whether you want to lose weight or whether you want to maintain your weight. That should be the topmost priority. As far as food goes, we should have a lot of salad, a lot of vegetables, fruits. If your blood glucose is well controlled, you can have 2 to 3 portions. The diet should be balanced. Portion control is important. A good amount of protein, with a fair balance of carbohydrate, like I have mentioned. Yogurt, if you have milk and yogurt, it should be fat free, less of salt, less of fat, stop smoking, and take alcohol in moderation. So these are the do's. As far as the don'ts are concerned, don't skip meals. So have your meals regularly, at least 3 meals, preferably 3 meals a day. Avoid red meat, avoid processed foods, too many sugary drinks, avoid too many baked products. I think that's enough for the don'ts.
Thank you. And I like to tell my patients that even if they don't join a gym or go out for a walk, if they just keep moving all day long, doing something all day long, it might be beneficial also. So how can they keep their diabetes in check and monitor themselves? Dr. Motushi?
Yeah. Again, that's very important. Actually, the tool they have in their hands is a glucometer at home, which they can use for home glucose monitoring. Now, we know that home glucose monitoring is mandatory for those who are on insulin. The question arises regarding its relevance when you are using it in those on non-insulin therapy. So, I personally feel it's a very good way to improve patients' compliance, involvement, and improve diabetes control as a whole. Now, in the first place, if you have a glucometer at home, the frequency of monitoring increases because you are avoiding the hassles of going to a lab. Secondly, it gives your patient the opportunity to keep track of his glucose levels, like whether it's going haywire because of indiscriminate eating or physical inactivity or whatever, and naturally he or she will become cautious. And also, if the blood glucose levels are going extremely low, then they can adjust their meal timings, the food pattern, and maybe medication also at times to sort of decrease the incidence of hypoglycemia. So overall, it's a way of empowering your patient to adjust their day-to-day activities to control glucose levels. You can also call it a sort of behavioral modification.
The patient can never make out if the blood glucose is going high, like 250 or something. So unless they test, they would never know. Many people say, I'm fine, I'm perfectly fit. So that does not mean that the sugar would be controlled.
So Mala, we've heard all this. So is there something that girls and women can do actually to find out if they have diabetes before they get it? And is this condition called pre-diabetes something serious?
Yes, pre-diabetes is a condition which is not in the values of diabetes. To simply tell you that if it is a fasting plasma glucose, anything between 100 to 125 would be impaired fasting glucose. More than 126, as you know, is frank diabetes, and if you are looking at the post glucose values, it would be anywhere between 140 and 199, and this HbA1c between 5.8 to 6.4. This is what we call pre-diabetes. It's very important to diagnose at this stage because it's a stage of prevention of progression of diabetes, where we call primary prevention. Everything else, preventing complications, is secondary prevention. Here you would even prevent the progression to diabetes, which is like a great thing. There are two instances which I call opportunities of prevention. One is the gestational diabetes that we've talked about, and the other is the polycystic ovaries. It's just very, very common nowadays. These two conditions are where we can actually, they can progress to become diabetic. So we can target these group of young girls and women and prevent them to become diabetic later. Apart from that, anyone who has high risk, like family history of diabetes, who are overweight, who are sedentary, and who have blood pressure or have had large baby like we discussed, all of these are also high risk groups, and they need to get monitored in a regular basis. According to me, they need to be screened after 30 years at least once a year, and that would be ideal to prevent. All the complications, whether you're talking about the heart or the strokes, they happen much earlier. So if you can catch that earlier, you may be able to prevent progression of complications and of course of diabetes.
Screening for complications, cardiovascular risks like hypertension and dyslipidemia also, I think, is very important in the pre-diabetes stage.
Absolutely.
And if detected, they should be taken care of.
Which brings me to Neeta. So what can we, all of us as the medical community, do to help prevent diabetes? Because once we get it, then we are only talking about how to keep it in control, how not to get complications. The best thing would be not to get it.
I'm glad you brought that up about what we can do. It's important to know that as a clinician community, we are totally engaged in treating diabetes after it has occurred. But I strongly feel that all of us should utilize some slice of our time in preventing diabetes. And to that end, we all know that diabetes is a notoriously silent disease, and to bring it out, what we need is screening, which means to say that we go out into the community and screen people who don't have diabetes and look for diabetes. So screening camps at every opportunity. You look at the relatives of the patients that come to you, people waiting in the OPD, anybody, but you screen everyone. The second thing that one can do, so creating awareness about the condition, maybe taking lectures, public lectures, maybe writing articles in the media and make people aware that diabetes exists. So my message to the women and their families watching this show would be check, check and keep checking and see whether you have diabetes or not. That's the only way we can prevent diabetes.
And I think the 5 important words here would be stay lean and stay active. So I think as we should all say that diabetes can be prevented, type 2 diabetes can be prevented.
Thank you all for sharing your thoughts, and we have come to the end of the program. And not only have they discussed the various aspects of diabetes management and prevention and important things like gestational diabetes, we have learned a lot about do's and don'ts. But what I want to add is, we just cannot afford in India to have this burden of diabetes or this to rise. We must do something. India is a very vibrant, young and wonderful country, and at the threshold of doing great things. So we shouldn't be burdened by diabetes. And for that, what all we can do as a medical community and as the community at large, we should be doing, coming together and setting our women free of diabetes, free of complications, free of mental health issues like stress, free of gestational diabetes, and make her live long, happy and productive life. And I speak for all my colleagues. We want to thank the International Diabetes Federation for declaring November 14th World Diabetes Day as Women and Diabetes. And I think this is going to shine the spotlight on them in a big way, and we really thank them for that. Achhe din aane wale.